Hello, my name is Loretta Patrick. This video is for my class, Math 143, and it is talking about math and nursing. Nursing is considered a calling to many. I've always known that I wanted to be a nurse from many years ago. Florence Nightingale is considered the founder of nursing. Way back in the day, even before electricity, out in the fields, she took care of wounded soldiers. She has definitely paved the way for nursing. The very first requirement in a hospital is that it should do the sick no harm. That is a direct quote from Florence Nightingale in one of her books. I feel as though nursing has been my calling. As I stated before, I've always wanted to be a nurse. My father died from cancer. I was very appreciative of the hospice nurses and all those that took care of him while he was sick. Proficiency in math is essential for nursing. I use math in nursing every day. I've been a registered nurse for 8 years now. Math is used daily at work while taking care of patients. And by my picture here, you can see we do have IV pumps in the hospitals, but as we all know, machines can make mistakes, so it's always good to have that knowledge to double check. An example is like if I have to give a fluid bolus, my order is to give 1,000 mLs over 2 hours. I know how to calculate that I will have to infuse 500 mLs per hour to achieve that goal. A medication that we use sometimes that is it's a serious drug, it's called TPA. There's a formula for it. It's the weight in kilograms, and then you take the 0.9 milligrams per kg. The next step is I have to give 10% of that total dose as a bolus, and then I give the remaining amount as an infusion over 60 minutes. As you can see, there are multiple steps to this medication. Here's my example. Just last week we gave this medication at work. The patient weighed 77 kilograms. I figured 77 kgs times the 0.9 came out to 69.3. That was my total dose. I then multiplied it by the 10% and got my bolus, which was 6.93, rounded to 6.9. I then calculated the 69.3 minus my bolus. I got 62.4 milligrams for my 60-minute infusion. The medication is mixed 100 milligrams per 100 mLs. So I set my infusion to go at 62.4 mLs per hour. I would like to also add that this was calculated on my pump, but because I knew how to calculate it also, I was able to double check that infusion. As I said, math is essential for duties performed in nursing. We use it every day. Correct math calculations in nursing could mean the difference between life and death. It is so important that as a nurse that I know what I'm doing as far as these math calculations. I do not rely solely on these IV pumps or even what the doctor orders. I would prefer to figure it myself just to double check. Thank you for listening.